Hey Beauty Cats! I am 3 days into healing from a plasma fibroblast treatment. I did my face 3 days ago and I treated all of my neck a day before that. So today I can wash the skin and that will cause the carbon crusting marks to come away, which you can see. And that's a residue of the static electricity, basically a tiny lightning strike to my skin, which works to improve collagen and elastin growth, or actually it heightens collagen and elastin growth in a pinpoint area hugely, and it also shortens collagen fibers within that area, which is why if you do a little bit of search on the internet, you'll see clinics showing doing treatments here on the upper eyelid or towards the lower eyelid, where when one area is being treated and it's lifted instantaneously, and you can see the difference between the untreated and treated area. I would ask you to be mindful when looking at results like that, because you may have skin like mine, which needs several treatments in order to attain the results that you want and deserve. It also should be considered that a patch test really needs to be done. Hyper and hypopigmentation are things that we look out for when we've performed a patch test. I like to do them just up near the hairline, on the forehead, or up near the ear, to see how a client's skin responds to the treatment process. Also, very thin and fragile skin may need a series of treatments to rebuild it and strengthen it so that it can respond optimally to the plasma fibroblast therapy, which is why I prefer to perform a series of 4 or 5 stage facelifting treatments in order to rebuild and strengthen the skin before I reach for advanced treatment therapies like plasma fibroblast therapy to perfect those results. So you don't want to be left with little indents in the skin or pigmentation issues. So make sure that you go to a practitioner that's going to perform a patch test and is going to wait a few weeks. A month is optimal, but 2 to 3 weeks, they'll be able to see if you are in fact a good candidate for plasma fibroblast therapy. So after 2 days, you're able to wash the skin, but you need to be gentle about that. And these little dots that you see, they will come away because it's just a little residue from the static electricity that is used in plasma fibroblast therapy, barely touching the skin. And that's called micro crusting mark. Okay, I'm able to wear makeup now, and it would substantially hide the marks that you're seeing. However, if somebody was close to you, they would see there's a darkening underneath your makeup. So consider healing when looking at plasma fibroblast therapy. I have no problem showing off my healing because I'm working with my body's own natural systems, triggering the healing response within my body to create renewed collagen and elastin growth and limit the need for things like injectable therapies, which at this time I'm not using. So I think that's something to be very proud of. And I think us girls should walk around looking like this a little bit more often and help reduce the stigma behind healing skin when it comes to treatments. Minimizing the toxins that are put into our skin by reducing the need for injectable therapies, I think that's a good thing. And we all want to look our natural best as we mature. So for more information on plasma fibroblast therapy, please jump on my website. I've got a comprehensive blog. We've got a website page that's going to give you more information, more before and after photos of the healing process, or send us an email and we'll work to help. Jessicat's Medi-Spa, working to get you more naturally youthful skin long term. All right.